Good morning. Today I will be informing you on a specific type of ligament. This is an ACL, your anterior cruciate ligament to be exact. This is my knee after ACL reconstruction. Gross, right? Not only is this gross, but it's painful. It is every athlete's worst nightmare to go through this type of injury, but athletes are not the only ones to struggle with this type of injury. ACL tears are so common. This can happen to anyone, anywhere. Many do not know much about this injury, which is why we will be going through what an ACL is, what the recovery process looks like, and ACL aftercare. First and foremost, to understand why ACL tears happen, we need to understand what an ACL is. According to the Mayo Clinic, your ACL is one of two strong bands of tissue which connects your femur to your tibia. This ligament helps to stabilize the knee and have full range of motion. Unfortunately, females are much more likely to actually tear their ACLs than males due to the differences in female anatomy, muscle strength, and hormonal influences. So the big question is, how does this even happen? There is no simple answer to this. In fact, ACL tears are much more common than some might think and can happen unexpectedly. Changing direction quickly, pivoting, landing awkwardly after jumping, stopping suddenly, or even receiving a direct blow to the knee can all cause this ligament to tear. Movements like these are most likely seen in high contact and fast paced sports like soccer, football, and basketball. Another huge question some may be thinking is, how can we know for sure if it's torn? When the act of a torn ACL happens, some usually hear or feel a popping sensation in the knee. This is usually the giveaway that you have torn your ACL, but other symptoms may be severe knee pain, swelling, loss of range of motion, or the feeling of the knee giving out when doing any minor activity. The only way to know for sure if you have torn your ACL is getting an MRI, if of which it is torn and it is severe enough, surgery will be needed. The next step to an ACL tear is recovery. After ACL reconstruction, the next 6 to 9 months is gaining back range of motion and strength. For athletes, however, this could possibly take as long as 12 months to return to the sport. The following 3 weeks after surgery is the most important for healing time, as stated by athletico-physical therapy. Throughout these 3 months, it is crucial that there's a good amount of nutritional intake and ice is used to decrease swelling. Between physical therapy and constant checkups with the surgeon, this will be a long process. Gradually, crutches will no longer be needed and weight bearing with the brace will be allowed. The remainder of the recovery time will be spent healing and regaining strength. Since weeks were spent healing, the hurt knee becomes very weak. At 4 to 6 weeks, range of motion such as bending the knee will come into play. Over time, the brace will no longer be needed and exercises to regain strength will be performed. Weight bearing, squats, balancing, and walking up and down stairs will all prove to be effective if done consistently in physical therapy. At 3 to 6 months post-op, patients should have regained enough strength to participate in high-impact activities like running and jumping. Nearing the end of physical therapy, patients will go through a series of tests to be cleared. These tests include functional strength, cutting, jumping, running. If an individual demonstrates these skills without pain and with good form, they will be cleared to either go back to everyday activities or return to their sport. After a patient is cleared, they will finally be able to go back to whatever it was they were doing before their injury. Although a patient is cleared, it is important to maintain strong and healthy legs so it will not re-tear. The risk becomes higher after just tearing your ACL once, from less than 5% to over 20%. Rothman Orthopedics shares different things a patient can do to ensure that they will not re-injure their knee. This includes strength training. The stronger the knees are, the more unlikely it is to re-tear. Strong knees provide stability for fast-paced transitions. For athletes, warming up and stretching correctly before games causes muscles to be warm and loose, which can also help with fast-paced transitions. Athletes can also focus on balance. Maintaining good composure can protect them from landing awkwardly after a big jump. Although these are not necessary for patients to do, they can certainly help and make patients feel more comfortable about their knee in the long run. Of course, there is much more to learn about all the fascinating ligaments that help your body function, but today we learned about one of the most important ones. Whether it is walking down a flight of stairs or simply just kicking a soccer ball like me, this injury can happen to anyone, which is why knowing what an ACL is, what the recovery process looks like, and ACL aftercare is so important for athletes and non-athletes as well. Thank you.